Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet. Come on over, Brad.
Oh, yeah.
We got a picture there.
Yeah,
So.
we got centered.
All right, today, Brad, we're going to talk about piriformis syndrome. Top 3 critical things you need to do now for this sciatica-like pain. A little bit what piriformis syndrome is versus just regular sciatica.
Right. So piriformis, what are we talking about, Bob?
It's a little muscle that's in your butt, Brad.
Oh, in the buttocks.
Yeah, in the buttocks.
Sure.
Before we do that, Brad, let's get the housekeeping out of the way first.
Yeah, let's clean up and mop up and get the work right
if
after.
you are watching this on the rebroadcast on YouTube, and if you're not on YouTube, get over there sometime, and you want to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Our channel is called Physical Therapy Video. And if you're not on Facebook, which we're on live now there too, you want to go over there and like us, because Brad and I have deep psychological issues and we need to be liked. And oh, by the way, we are giving away something, Brad. Where is that caliper?
What are you looking for? I put it away, Bob.
I knew he did.
I thought I'd clean up polish.
He's just like, it's like I get up in the middle of the night to go to the bathroom and the bed's made when I get back. That's Brad. He makes the bed in the middle of the night. Well, no, not that we sleep together. My wife makes the bed.
Why, Bob? Why?
All right, we're giving away 3 of these calipers. They're by Baseline. Really nice. They it has a little bit of spring there,
tension on there,
and it holds on by itself.
Right. You can use it for
measuring fat content.
Right.
And what you want to do is eventually improve. So
exactly.
So go to our Facebook page. There's a big picture of this on there. Just like the post, and you're in the contest.
Right. It's a handy dandy little tool to have around. You can easily put it in your drawer and use it on a regular basis. And if not, you can always use it for something else.
Just watch the fat melt away when you use it.
Good motivation.
All right. So now we're going to go back to the piriformis syndrome. Generally, what you're doing is you're getting pain, numbness, tingling going down your leg. Now, these are 3 things that generally I see with piriformis syndrome versus just regular back pain. With our regular sciatica, which would be a bulging disc or a herniated disc.
Right, from the low back.
Yeah, generally with the herniated disc, you're also going to feel pain in the low back.
Right. Then it refers down.
Yeah, in piriformis syndrome or piriformis muscle syndrome, generally the pain starts in the butt and goes down.
Right.
I don't even feel it in the back.
So this red piece of duct tape, which represents the piriformis muscle, you notice we use red duct tape so it looks like a muscle, and that's where it goes. It connects from the greater trochanter of the hip and just underneath in the sacrum.
Yeah, it starts in the sacrum and it attaches here. Origin insertion.
Right, if we're getting technical.
Yeah. So as you were saying, Brad, it's kind of a triangle-shaped muscle, I believe.
Right, right.
And attaches here. And what's so critical about this is a bunch of nerves come together and they form the sciatica nerve, which is a pretty thick nerve.
Right. And
it comes right underneath that muscle. And that muscle can tighten down over the nerve and send pain down the leg.
Right. Anytime you impinge on a nerve or irritate it, you're going to get symptoms down the nerve path, which in this case goes all the way down to the foot.
Now, why does this develop in the first place? In some cases, Brad, the nerve actually pierces through the muscle.
Sure.
I've found, I think in a lot of the cases, the muscle got torn sometimes, and it started to heal and thickened up a little bit. Scar tissue. That's just my theory, and it seems to fit with the way I treat it and what has happened with a lot of people.
Right. In the school setting, we call that the model. Your model.
Sure, my model.
They don't care. They probably want to know how to treat it.
Right. And when I was looking up on PubMed, Brad, they did a study on this, and they did some imaging of this muscle on people who were having the pain, and they did find it was thickened. And they didn't say why they thought it was thickened, but
that would make sense. Scar tissue typically is thickened, so we need to break that up.
So we're going to break the scar tissue up. We're going to stretch that muscle out. We got to calm it down. All these certain things we're going to do to do it.
Right, and we do have a video specifically on tests you can do to determine whether you have piriformis syndrome or if it's from the disc.
Disc or herniated disc.
Right, it's a very popular one as well.
Say goodbye to Napoleon.
Yep.
Bone apart. That's our little joke. Bone apart.
Get them out of there.
All right. So first thing you're going to do is, one thing you may want to try. This is not really part of the 3, but if you wanted to calm it down a little bit or heat it up a little bit and make it feel better, you could use the Thermotex. We've been talking about this.
I thought you were going to say have a beer.
A beer would probably do it too. By the way, this reminds me, Brad. we're going to run this typically of how we run our live events. We're going to go over through our material first, and then we'll try to take some questions at the end.
Sure,
so
you bet.
Stick around. The Thermatex, this is far infrared heat, and it's got 3 panels. The reason this is different than regular heat will only penetrate a few millimeters.
Right.
This will penetrate up to like 60 millimeters, which translates, do you remember the number, Brad?
2.36 inches.
Yeah, so that's quite deep.
Right. You're going to get as deep as you need to get.
It's going to go into the muscle if you use the Thermatex.
Right.
And so we just thought we'd give a little plug for it. This is the Platinum model. You always, the hard panel goes to the body because that's the way the rays are directed.
It can be directed.
Yeah, and you can just sit on it. You know, sit on it, Patsy. Remember we made that joke last time? From Happy Days.
Oh, yeah. Let's get on with the program here.
All right, so you can warm it up really quite well. This is actually warm right now.
Oh, yeah, it feels great. I was going to sit on it just because it felt good.
So we'll put a link on that below. But so the first thing, and this actually, if you want to tell if you really have Piriformis syndrome, a lot of times you're going to feel a tight feeling in that muscle versus the other side. So let's say I got the Piriformis syndrome on this side.
Okay.
If I lay down flat on my back and I take my knee and I pull it over to the opposite shoulder.
Right.
Now you can also do it this way. You can put your ankle on your knee like this and then pull it over like that. That's just a kind of a clean way of doing it.
Sure. Yeah.
If I do that, it feels really tight, maybe even a little painful. Then I do it on the other side, and there is no tightness, there is no pain. By the way, I am looser on this side.
There you go. You might have a start of Piriformis syndrome.
That's one sign that it might be Piriformis syndrome. The other thing is, if you find that you do have tenderness on the right side and not on the left side, again, another possibility you might have Piriformis syndrome.
All these indicate that there's more potential of it. So,
and again, if you don't have pain in your back.
Right, right.
So, yeah, the first stretch you're going to try is you're going to put your ankle right across the other knee, and you're going to pull it over like this.
Right.
Now, you can do pressure on, pressure off, pressure on, pressure off, or you can just do a sustained stretch.
Yeah, just hold it. You can hold it up to 30 seconds if it's doing well with it.
Yeah, 3 times 30 seconds, and
Right.
you can do that. You can do that throughout the day.
Sure.
So
as long as you get a place to lay down, if you got to work, sometimes that doesn't work so well.
no, lay down at work. Tell them Bob and Brad said it's okay.
There you go. Yeah, that's really all you need to do.
Now, if you want to advance this stretch, you can grab underneath here and pull up like this.
So that muscle right in there is getting a pretty good stretch with that.
If you find that difficult to do, you could take a belt or a strap or just like the strap. Your dad used to take the strap to you, didn't he, Brad?
Well, only when I deserved it.
My dad was such a kind man. He was a military man at one point, but he was supposed to take me behind the shed and punish me, and he couldn't do it. He just said, "Don't tell your mom I did it." So, all right. So you can take the strap like this. If you're not able, that flexibility, and you can pull it up like this, and it works out really quite well.
Right. Exactly.
All right. You want to show the other?
Oh, the figure 4.
Yeah, this.
No, I call that the figure 4, the pretzel. This is.
Yeah, we're making kind of a 4 with the legs.
Right.
As you can see.
So, right here, you see how that makes a 4? Okay, well, anyway. They can't even see me. I'm off the channel.
Lonnie, you want to bring it over here? And I'll bring the camera over.
Sorry about that.
There we go.
There we go.
Rad is back.
So if you get, depending how tall you are or how tall your cupboard or table is, this one's a little bit short for me, but this would be a little tall, but I can make the short one work. I cross like this. So if you look at it from this way, I cross like this. You got to have healthy knees for this and everything. You got to be a relatively fit person to do this particular step because it's a little aggressive. And then I'm just dropping down, and I'm going to lean forward, and I can feel right there on that piriformis muscle. I'm getting a real nice stretch. And I'm just going to relax. The nice thing about this one is you get to that point where you feel a nice stretch, not a sharp one, just a nice one. You can just sit here and relax and get that 30 seconds, and you don't have to pull like on the other one.
Right.
Use some arm strength.
Yep.
So yeah, I'm just going to hang out here.
All right, we're done with you, Brad.
Oh,
all right.
Still going to hang out.
The next part is the one that I have found to be the most helpful with people, and that is to do some massage on the area.
Sure.
And obviously, it's something that's going to be very difficult for you to massage on your own. Now, there's some suggestions online, and we've even made this suggestion in the past. Maybe Brad, is to use a foam roller.
Sure.
Or to use like a lacrosse ball.
Right.
Personally, I haven't had any of my patients start with that. I just think it's too aggressive to start off with.
Well, I always use a tennis ball. It's not as aggressive as a lacrosse
Right, a tennis ball, you're right, would be better.
Right.
I still think it's a little aggressive to start with, Brad. So what we prefer is that you maybe take one of these handheld massagers. Now we have kind of a range here. This is the Nursel, and we've shown this on some of our other videos. This one was like, well, about 35 or something like that.
Right in the 35.
So, and it's one you have to plug in, and it's got kind of different heads on it too, but it works out pretty good. Right. I mean, it'll do the job.
This one works in an orbital fashion. It doesn't percuss like the other one we're going to show, so it's not as aggressive. Right.
And but you know, you can lay down, and I mean, there's no good way to do this except you got to get there and massage the butt.
Bob, I can't watch.
All right, I think we get the idea.
Yeah.
But you know, this is going to help get more blood flow to the area, help break up scar tissue a little bit, and
you'll know if this is going to be effective. It may be a little painful at first, but as you do more, it's going to be one of those. It hurts so good, and when you're done, it clearly feels better.
Yeah, work around the area first. If there's a real painful spot, hit the spot that is less painful at first, and then eventually work into that.
Sure.
You got. Oh yeah, here it is.
Oh yeah. We've got the Pure Wave.
This is the Pure Wave. This is one of our favorite massagers too. A little more expensive, but it's also, you don't have to plug it in. It's cordless.
Right. And it's very well built. It's made for professional use. Yeah. We do have one at all of our.
So this is going like this.
Right.
On this one here, and it has a bunch of. This one is kind of a patent design. I like this one because it's air filled. And so it's very soft. You can actually go over bones with it, and it doesn't bother it.
Yeah, so, here's the more aggressive heads.
Yeah, this one especially.
That one really gets into the spot. This one is a little firmer, but across the broader area. But if you go over a bony tissue with this, it's not going to feel good.
Yeah, so I generally start off with this one, and then I actually may go to the pointer one, Brad.
When you want to get specific?
Yeah. Well, maybe after a couple treatments, I go to this then.
Okay.
And I have had patients and that or massage with their hands.
Right.
The patients a lot of times say this felt better and this did better.
Well, I tell you what, as a therapist, you go for a few fingers get sore.
Yeah, you get too
very uncomfortable.
Right.
I don't know. You know, even professionals living and they don't want to go out of business.
So yeah, you're going to calm it down with the massage. You're going to calm it down with the stretching, and then the third critical thing you need to do, Brad, is some strengthening. You got to start getting a little strength to that.
Right,
muscle.
And this is when it's starting to feel better. Yeah, you want to get back into your.
We're further along now, and we're trying to get a little strength in that muscle. So very simple. You're going to lay on your stomach, and I'm strengthening my heel. And I'm hooking it right onto the back of my knee here. Okay? And I'm lifting the leg up like this. This is, Brad, you should try this one once. I can tell I don't work on this muscle at all because it's very, very weak. It's what we call an external rotator of the hip. And it's just, I can tell it's not part of my repertoire right now. So it doesn't take much to work on strengthening that. Now you go more to the edge here and get a little more up like that. Yeah.
You know, you could do this on your bed.
Firmer bed on the edge of the bed. Some other hints with when you got piriformis syndrome, if you're sleeping on your side, on my side like this, my leg is over like this. Right now I have a kind of a stress on that piriformis muscle. So you want to go ahead and sleep with a pillow between your legs. It's just going to feel a lot better. It's better for your back anyway. So if you sleep on your side sleeper, it's really good to have the pillow. The other thing is you could use the leg wedge. Oh, Lonnie, can you throw that to us? Let's see if Lonnie can get to it. I think this is a device too that'll take some stress off. We've recommended this many times. You can go on Amazon. They're like $25, right, Brad?
Yep, I have one at home. Been using it this week as a matter of fact.
Really good for the back. And this will be good, actually feel good on the piriformis too. It takes stress right off of it. So,
Bob, I do want to say, because I'm not in complete agreement with you, and Sarah also, Sarah H said so too. She went right to the tennis ball.
She did.
And she said she had great success.
I'm glad to hear that. That's why I like doing these live events, because I just felt like maybe we're getting too aggressive with it.
Right. I agree it is aggressive, but can I demonstrate?
Yeah, you go ahead and demonstrate it. Thanks, Sarah. I appreciate that.
I don't know where Sarah's from. Sarah, could you chime in and let us know where you live? I mean, not your address, but just kind of generally. So this is the lacrosse ball. Pretty aggressive. The tennis ball, I would definitely start out with. And you get that right in here. And now you're not going to go right on it really aggressively. I'm going to work. A lot of my weight is on my elbows and on my feet. I'm just kind of work into it. And you'll find when you hit that, what we call surface, the hot spot, which means it hurts. And don't go after it real aggressive right away. It'll hurt. It's going to hurt so good. And even the Piriformis on this is a little tender on everyone if you use this.
Sarah's from the UK.
Oh, great.
That's United Kingdom, Brad, in case you don't know.
Oh, thanks, Bob, for clarifying that. Would you let me work my Piriformis?
Yeah, go ahead.
There we go. And then you can get more aggressive like this.
Someone had asked where the Nursal, it's Nursal. You can get that on Amazon too. Well, I'll try to put a link below later, but it's going to be a couple hours before I get to it because I got to work this afternoon.
Yeah, unfortunately, we do have to work.
All right. The other thing is you don't want to sit on a wallet.
Right.
Yeah.
Bob's got a really big fat wallet and he puts it in there. Just you know how that is. But anyways, you put something there and you sit on it, and not only does it can irritate your piriformis, but it can tilt your pelvis, which can irritate your lower back as well. So it's one of those things best to put in your front pocket or leave it at home.
And going right along with that, if you tend to lean on one side all the time, or if you tend to sit with your legs crossed, that's going to put pressure uneven. The last person I saw with this, she was an accountant, and she sat a lot, and she sat on, like she'd definitely feel when she sat on hard bleachers and stuff, hard surfaces. But she sits all day, and I try to get her to sit with a better posture because the more you're sitting upright, the more you're putting on the heavy, meaty thigh as opposed to the bony part in the back there. So
how about this one?
That would be a bad one.
Some people sit like this, and that really throws things off.
I would avoid lunges for an exercise while you're dealing with this, because it's going to put some stress on it. And I would avoid running on hills because that's going to.
But you get the uneven leg length essentially.
I saw on there, Brad. You could look for some more comments, but some people said they were taking the balls and they were putting them in a sock, and then they go lean against the wall, and that's a very good idea. So you put the tennis ball in a sock, and then you can lean it and you put it behind you, and you can use it to work your back. You can use it to work your piriformis. You can use it to work just about anything. I think some people were saying that's what they were using for multiple purposes. So, any questions from Facebook, Brad? Bonnie, by the way?
This is from Lando Hearing. Why do my hip flexors hurt when I lay on my back?
Okay, so your hip flexors hurt while you lay on your back. I'm guessing that you may be getting some impingement in it during the day. I guess without seeing you, the only general thing I would say is probably try to do a hip flexor stretch, which you want to throw me a pillow, Brad? I definitely, people a lot of times get tightness in the hip flexors, especially if they sit a lot.
So these muscles right here.
So this is a simple one to do. You're going to kneel down like this, and you can do this on the floor. You can put a pillow underneath your knee, and I'll look how I'm leaning forward. I'm keeping good posture, but I'm stretching that hip flexor.
Straight here, but that's where we get that stretch.
It's a good one to do. It's one of the stretches I do almost every day because it is a muscle that tends to get tight on people. Another way to do it, which is would be off of a bed, would be if I'm stretching this one, is to lay down like this and then lean up like this. So I got one leg off, I got one leg up, and so I don't know if you heard the question when Lonnie asked it. Somebody was getting pain when they lay down on their back in their hip groin or hip flexor.
Bob, we're getting quite a few questions about people with MS.
Oh, really?
I think to address that, it's almost, I don't know if we can address that broadly.
We need to probably do a video on multiple sclerosis. We haven't done one. When I was in school, I actually went to an MS camp for people would come for a summer camp that had MS. And there's the two types. There's the one that's kind of a stable MS, and then there's the one that kind of exacerbates and remits.
Flares.
So, it's always maintaining and protecting that you're not getting too fatigued with MS.
Right, because,
But yet you do want to try to keep your strength up to some extent. There's definitely, you should be doing exercise programs.
Right.
I think I saw that one that said she does exercise on a ball. Did she say? I think you might have missed that.
Yeah, but there's been quite a few. So it's hard to address it on this video with Piriformis because I think it's more specific and we'd like to get to approach it.
Yeah, MS is a good one for us to do a video on. We haven't done one yet. And anything else on Facebook or anything else over there, Brad, we can. By the way, I always like to say this at this time. I apologize that we don't answer comments like we used to. We've just gotten overwhelmed. There's just too many per day. And Brad and I still work full time with patients, and we're trying to put out 7 videos a week. So it just doesn't leave any time of the day. Our family would probably abandon us if we.
Right, exactly. Yeah, we gotta make sure we keep our wives and children happy.
Yeah. So, any other questions, Brad?
Well, Bob, I just keep rolling in. And a lot of them are some wonderful comments. I appreciate those.
We always appreciate the comments.
Here's one. They had a couple of them already. The second one, the other one was an unusual name. That I think it was a kind of a code name. But this one, tips for when driving. If driving is painful, it may be you have a low back issue, but it feels like, because the symptoms can mind each other, it can mimic each other. So I would definitely try a lumbar support in your car. Or adjust your lumbar support. We have a
whole bunch right here.
Right.
Let me pull a chair out. Yeah, with your car, one thing you want to make sure you're sitting upright. Don't have your it reclined back like this or like this. You want to be upright. You want to have the steering wheel close to you. You don't want to be going like this.
Right.
And
no wallet in your pocket.
No wallet in your pocket, right. And you're going to be upright. And the seat itself might have a lumbar adjustment.
Right.
Look on the side to see if it does.
Yeah, some people aren't aware of it. I've had patients with that, and they found out, oh, I do have lumbar adjustment, and it makes it better. Here's a lumbar roll from McKenzie.
Yeah, McKenzie, and this is a round one. A lot of times we tell people you can just try a rolled towel yourself and see if see how that feels and see if it does help. And then you can also determine kind of how big of a roll you want.
Right, because they make these in different sizes. Because you'll want if it helps with the towel, you'll probably want to purchase one of these because they're just a little more comfortable.
It's very personal.
Right.
What you're gonna, because now I like a real thin support behind me, and Brad likes this one.
This is the one that I found to be the most effective for me. I've tried a lot of them.
This is NAPO, N-A-I-P-O, and it's memory foam.
Right.
But for me, it's way too much.
Yeah.
I like this in my office chair because it kind of pushes me forward a little bit. And I can work real well. It keeps me upright, but I do not like it in my car.
Right. I think, with one of my cars, it works really good, the one I drive most of the time, but the other one, that seat conforms 6 too far, and it is too big in that. So it does depend on not only the body, but what you're sitting in. If you got a big hollow spot in your car seat.
So it may take a little experimentation on that for that one.
There's somebody here. Could you please show how to do Piriformis stretch with a straight leg up on a ball?
Straight leg up on a ball. I don't know that you're really stretching it with a ball. You know what I mean? Because on a ball,
maybe I don't understand, but
yeah, it's got to be. It's an external rotator, which means it moves the hip this way. So you got to bring it into internal rotation, the hip, in order to stretch it. One other way you could do it would be, you could go like this and go like this and like that. That's stretching it. Wouldn't you say?
Sure. Right.
Anytime you're bringing the hip internally rotated, it's stretching it.
Yeah, with the ball, I'm trying to think. I don't know
how you do it with the ball. You want to get a ball?
Unless you use a little ball and you roll like this on it, which actually it's softer than the table. I'm just therapists. We're coming up with new ways to do exercise. What are you laughing at, Lon? There we go.
The question was again how to use a ball to do the Piriformis stretch, and there's not a real great way to do that. I think you're going to have to use one of the ways we use.
And maybe they're thinking of something that we're kind of the same wavelength.
So any stretching that someone can do. Oh, is there any stretching for this that someone can do that has had a hip replacement?
That's a good question. Yeah, I wouldn't be doing that stretch with a hip replacement. Yeah, there's just especially you don't want to do really any aggressive stretches with a hip replacement. It just, there's always that worry you could pop the socket, you know, it could pop out of the socket. It's just, with hip replacements, I'm sorry, you're just limited. And then it depends on which way you had, you know, if you had an anterior approach or a posterior approach for your surgery, that can determine, you know, which way you're allowed to move the hip. It's just, no, I'm sorry. You can do the massage with you know, after a hip replacement, you can certainly do massage in that area,
yeah.
but you can't be doing stretches.
No, not like that,
No,
really.
Sorry.
There's been a couple questions on people having the extra foam on their mattress or the gel foam on their mattress. Is that going to be good for their hip and their back?
I say yeah.
Yeah. I really think you just have to try it, but I wouldn't see why it would bother anything unless it gets.
No, it's one of the recommendations we used to make. I used to do a back school at Mayo Clinic.
Okay.
And they'd say, especially if you have like what you like to do is have a kind of a firmer mattress underneath it, and then you have a soft foam on top of it.
Right. Okay.
So then you get the support, plus you keep good posture, plus you're getting the soft feeling of
sure. That makes sense.
One of the recommendations we used to make is, you know, if you're thinking your mattress isn't firm enough, throw it on the floor a couple nights and sleep on it and see if it feels better, if your back feels better.
Sure.
So,
or just, I literally, I've had people sleep on the carpeted floor and they sleep better with their back pain. Not piriformis syndrome, that's typically on the, you know, the spine. We might be getting off topic here, but Bob, look, it was 27 minutes we've been playing here.
All right, well, we'll bring it to an end here, folks. Thanks again for watching, and make sure you hit that subscribe button, man.
Oh, yeah.
There you go.
He likes to do that. That's a
Mackenzie. M-C-K-E-N-Z-I-E.
Lumbar roll, Mackenzie lumbar roll. Here, I'll see if we can fit it right in there. Catch it.